Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. I'd like to welcome Dr. Nanette Nuessle and Audrey Safman. Thanks for joining us today, Nanette and Audrey.
Thanks for having us, Kim.
Thank you, Kim.
You're very welcome. By way of introduction, Dr. Nanette Nuessle is a pediatric hospitalist, executive healthcare consultant focused on big T and little t trauma, and you can speak to that if you'd like to. Effective communication in the workplace and team building. And Audrey Safman is a member specialist for Doctors for America, and she comes from a family of physicians. And through our discussion, we talked about some of the pain points facing doctors today and the work that we're each doing to support physician wellness. So today we'll be talking about how we're all aware of the struggles facing doctors today, and from each of your perspectives, what we can actively do about it as non-physicians and as doctors. So I always start by asking what you'd most like our audience to know about you. You can include anything, even hobbies. Nan, would you like to go first?
Well, the one thing I would like them to know about doctors in general is we do a lot of work behind the scenes. Our nurses are the ones who are there at the bedside, but what a lot of patients don't realize is me being in the hospital, being a hospitalist, in a month, I work about 4 times the hours a nurse works. It is not unusual for me to round in the morning, see all my patients, get all my work done, go back to my hotel or my Airbnb for a few hours, but then have to come back and round again with the nurses on the night shift just to make sure everything is understood on every patient. And I get phone calls in the middle of the night. I can never be more than 30 minutes from the hospital. So even if my work is done and everything's cool, I can't go take a 30-minute walk unless I walk 15 minutes away from my car and 15 minutes back and pray I don't get called the whole time. So there's a lot going on that our patients, our clients don't see. And knowing that those are the kind of hours we work, 480 hours a month is a bit high for me, but that's what I'm doing this month. Um, it's closer to about 380 most months, and that's a lot. That's more than, recently there was a thing in the media about younger doctors not wanting to work 60 hours a week. No, it's not that. It's about younger doctors not wanting to work 100 hours a week, having to sacrifice completely their social lives, being completely out of touch with just the cultural norms, what's going on in the movies, what's going on in your community, because we are working so many hours per week. And the media interviewed older physicians working 60 hours a week who said, well, that's the job. There are a lot of us, I'm 65, there are a lot of us who've worked 100 hours a week for over 30 years. And if they'd interviewed us, we would have been all for these younger physicians wanting to set better boundaries, because setting boundaries in your workplace and communicating them well is one of the things that allows you to actually relax both in the workplace and on your days off.
Yeah, well, thank you for sharing all that. I appreciate it. And it's important to shed light on these things that non-physicians really have no idea about, and it's not on their radar. So thank you for sharing that. And Audrey, what would you like us to most know about you?
I think so. I'm coming in from a unique perspective of one, the patient angle, but also having observed these physicians working the hours like Nan just discussed, having my grandfather who had been a very prominent physician and his entire work was life, and it drove him to the ground and he eventually passed of ALS. My aunt, who's an orthopedic, who has MS, and it just seeing the stress that compiles. And then through my work at Doctors for America, which is an amazing physician advocacy organization, I get to connect with a lot of doctors and medical students and other medical professionals. And what comes up time and time again is how medical schools and medical organizations, they don't emphasize the need for wellness among their staff. They don't honor boundaries. They don't honor the effects of stress on the body. And it creates this really toxic dichotomy where we are having an organization of people trying to treat people and make patients well when they themselves are so unwell and the system is so unwell. And then it becomes this battleground of sacrificing yourself for your career, and it only hurts the patients, the doctors, and the organization in the long run. And so for me, through my own life, my own experiences, I've integrated a lot of wellness techniques and regulating my parasympathetic nervous system. And just, it's a big passion of mine to help, especially the medical community, understand that there are easy things that you can integrate: box breathing, nasal breathing, in between rounds, while you're scrubbing in, to just center and ground. And I'm hoping that, as we move forward with repairing our very sick healthcare system, that this becomes something along with advocacy that is integrated into medical schools, integrated into fellowship rounds, and it heals that heart of the medical system, placing doctors in that place of respect as a whole, where patients can then feel more welcome, more easeful, and have that vulnerability that's so important for building those patient-doctor relationships.
Absolutely. I appreciate you saying that. And I've repeated what Dr. Kathy Stepien has said many times: everyone wins when physicians are well, and how, physicians in residency are trained to suppress their own needs, even to eat and to go to the bathroom, right? And then that doesn't change when they become attending. So we need to focus on the wellness of the doctors and staff, exactly what you're saying, and breeding ground for stress. Yes to all of that. Nan, what does that bring up for you, what Audrey said?
Um, it brings up memories of me leading breathwork sessions. I worked for a while at a refugee camp, and they had me on night shift, which is not my favorite, but it was such a worthwhile cause that I took a cut in pay and worked at a refugee camp for 3 months. And the staff, we're all working 12-hour shifts, and we're coming in at such a time that we can't get dinner on site. And we're supposed to be getting off at 6 in the morning, but because of organizational meetings, we were actually getting off at 8 in the morning. So we're doing 14-hour shifts, and we're losing people right and left. So things would calm down a bit around 2 a.m. And somebody else started doing yoga sessions around 1:30, 2 a.m. People would bring in their mats. And then I would follow that with 30 minutes of breath work. And it was just amazing how the tension in the place would just melt away. And when we're calm and we can let go of our tension, it's much easier for us to create that feeling of a safe space for our patients. It's much easier for us to listen without interrupting and to encourage them to be open and vulnerable and tell us what's really happening. They have things going on behind the scenes as well. They may be coming in for an ear infection, but you've got an 8-year-old boy there with an ear infection who's accompanied by his 18-year-old brother because their parents didn't make it out.
Mm-hmm. Yes.
And you can give them an antibiotic and send them on the way, but it means so much to them if you sit down and you listen and you take a little time to say, so what is your plan now that you're 18, almost 19, and your college plans have been ripped away from you? And what social services do we need to help you with to put that in place?
Mm-hmm. Yes, I know that's all so true. And as far as breath work, some people who haven't tried it or don't know anything about it might just think, oh, yeah, there's, not much to it. But I know in the past few years, amidst my own, health challenges and stresses and struggles, when I learned more about that, it really is a game changer in learning to recognize how you feel and where you hold tension. I think I was developing some TMJ issues, and just being able to recognize when you're clenching your teeth, right? And all of that. It can reduce neck pain. There's a lot of things that breath work can help. And Audrey, if you want to respond to anything Nan said, and then also a lot of people won't have heard of Doctors for America. So also share with us more about what Doctors for America is.
Oh, they're
Absolutely.
amazing. I will say that. I will agree with her on that. They're amazing. I have um, done some work with them and I've met several of their leaders in person. But Audrey, tell us all about it because it's such a wonderful group.
Of course. Well, I'll start by touching on a few of the points Nan brought up. So with the breath work, I mean, through my healing process of both emotional and physical, I would say breath work is the biggest thing that I've seen the most change with. And we're in this wonderful period where, I mean, breath work and yoga and meditation, that is ancient. These practices have been around for so long and they're finally being integrated into the Western culture, and it's backed by research. There are so many studies, so many statistics that I think really help bring the medical community on board with these practices because, let's be honest, doctors love evidence, they love numbers. And so being able to back that up, but it changes your entire regulation of your body. You learn your body, you become in tune with your body, and your breath is the one thing you have for free at every moment.
Mhm.
And so when you learn how to control your breath, you learn how to control your entire lives. And this is such a symbiotic reaction because when we heal ourselves and we calm ourselves, that radiates and transforms the people around us. So it's such a powerful tool to use in hospitals and patient care settings. And then also creating that dialogue, which Nan touched on, of not just looking at the patient as someone who's in and out the door and you need to look at their symptoms. They are a whole person. And fostering a sense of safety and vulnerability is so quintessential to meaningful, lasting care because just masking the symptoms doesn't treat anything. And just because they have a cough or they have a rash, there's so much more going on. So I think it's so important for doctors to let their patients know, I need to know your life story, essentially. I need to know that you are 18 and you've lost your parents and you're raising your little brother. And the amount of stress that's causing on their system is going to be so much more than just an ear infection or a headache. And so just really getting the whole picture and patients understanding as well that their doctors are still human. And also, if your doctor isn't making you feel comfortable, find a new doctor. It's your health and it's your agency. So be the authority in your life and you have that free will. So utilize it, but also have respect for the person treating you. I think respect is something we're missing and it's so important. And then with Doctors for America, so as I said, we are a physician advocacy organization. We have over 30,000 members across the country who are, especially now more than ever, mobilizing together to fight for the rights of patients. So many basic patient rights have absurdly become political issues, especially reproductive rights and things like gun violence and substance abuse disorders. So we have multiple impact areas centered around these issues, and especially with the Affordable Care Act and helping patients get access to affordable care, because there's no reason someone should have to be bankrupted by their insulin. There's no reason politicians who do not have medical background should be dictating the care people can get, who can get it, and when they can get it. And so our entire mission is to just place patients back over politics. And there are a ton of great ways to get involved with us. So we have impact areas that have monthly meetings. We do frequent visits to Washington, D.C. to meet with legislators on the Hill. We have a membership program that unlocks CME credit and a ton of other great opportunities. And you can also just make a donation. But it really is such a community of these impassioned, empowering, like-minded individuals. And it's a great way to just connect with other doctors, other medical practitioners, med students, residents who share your interests and want to be the voice of change. And so it's just an incredible organization. I'm incredibly fortunate to be a part of it and see the impact that our doctors have it, day in and day out.
Well, thank you. And I'm very happy to be spreading the word about Doctors for America. And Nan, what has been your experience with Doctors for America, and anything you wanted to
Well,
respond to what Audrey said?
my experience was that I met some of the members at at a national medical conference. One of them was speaking, and we connected afterwards. And then I had the opportunity to meet her again later at a political rally. And it was just very reinforcing of how they walk the walk. Audrey said, commented on creating safe spaces where people can be vulnerable. And that's exactly what DFA does for physicians. Their monthly meetings are exactly that. They're a place where physicians come in, know that it's a safe place, know that everything there is private, and they can be vulnerable about the things that they're dealing with. And that's important to me because it's something that we are not really good at creating in our workplaces. We need to focus on taking care of one another as physicians. We need to take care of our colleagues, our physician colleagues, our nurse colleagues, our respiratory therapy colleagues, the pharmacy technicians. We are a team, and we really need to foster an environment where people can speak up without fear of being silenced, without fear of retaliation, without fear of job loss or having a worse call schedule because they spoke up. And because all of those things increase the stress that we are under as healthcare workers and decrease our ability to bond and work together. And DFA is an organization that promotes all of that. But the work that I'm doing in terms of stress in the workplace is helping people deal with their emotions, helping them figure out when they're triggered, what's triggering them, how to release that so that they, number one, don't dread going to work the next day, because that is huge. There's a lot of people who become physically ill thinking about going to work the next day. When you create an environment where you're helping each other reduce stress and you're doing the internal work to control your own stress and your own overreactions to things, that's huge. Because if you've got one physician in the group who's overreacting to everything, it affects everyone else. It drives up everyone else's cortisol and adrenaline. When what you really want to try to do is encourage an environment with more oxytocin, more serotonin, oxytocin, the love hormone, serotonin, the happiness hormone. When you do those things, you can still have a stressful environment and encourage those things. The work becomes easier.
Mm-hmm.
The
Yeah.
teamwork becomes better. The communication improves and there are fewer errors.
Mm-hmm.
And so that's where a lot of my work has been focused lately. And I use combination of personality science, breath work, as we discussed, energy work. A lot of it is, most of what I do is based in quantum physics. And there's tons of information out there. It's just not the kind of thing that most physicians read. And honestly, we don't have the time. We don't have the time to curate that material.
Mm-hmm.
And that's why it's important to bring in somebody who does know what they're talking about with that and have them teach your unit or teach your team or teach your clinic how to better manage all this stress.
Mm-hmm. Yeah, you're right. And I just shared an episode today, and I shared in that about there's no time to think about the patient, right? Doctors don't have time to think at all, and they need time to think. And also, I loved what you said about like fostering a healthy team culture. That's really everything. So, Audrey, anything you wanted to follow up on what Nan said, or anything you want to add?
I just think, it comes back to that regulation standpoint of learning these tools to regulate yourself helps everyone else regulate. We've all been in a room with someone who is flying off the handle or overreacting or playing the victim blame game, and it is suffocating to be in. And then when you take that into a high stakes environment, when you have that in the OR, it's so detrimental. And it's also affecting your patient on the table. They might be under anesthesia, but their body is still responding to everything because their subconscious mind is still going, their processes are still going. And so just learning these tools that are, yes, easy to regulate and bringing someone in who has the knowledge and is qualified, like Nan's talked about, like Nan is, to integrate these principles into just lessons. It doesn't need to be something you spend 5-10 years on, just 5 minutes a day. Take some time for yourself, do it while you're in the bathroom, and it will make such a difference. And it's one of those things of you have to keep in mind, how do you feel when you wake up in the morning? How do you feel on your way to work? How do you feel after work? How do you feel coming home to your family, your kids, to yourself? If it's anxious, if work is making you physically ill, something needs to change because we are here and we're doing this work and it is admirable and it's amazing, but you need to put yourself first. And that's not selfish, that's self-care. And that self-care radiates onto your patients. And so if you're working in medicine and you have nothing left, explore your options. And I'm hoping that, we move into a space where we can voice when things aren't working without fear of bullying or discrimination or losing our jobs or getting the short end of the stick because we decided to speak up. We need people to speak up. We need people to use their voices, and we need people to be their own advocates. I think that's the only way things change. And it's the only way that we repair this dis-ease that is so rampant in our healthcare system and also in this country. We all deserve better than what we've been told we need to do.
Mhm. Absolutely. And that's what I love about these conversations is you two hadn't met and, just elevating awareness and bringing people together so that people don't feel as siloed or like they're talking in a vacuum. Right. And then if you share this with your networks, then people will have heard it that wouldn't have otherwise heard it. Nan, is there anything you'd like to share as far as what helps you overcome challenges or anything that brings you joy? Because we always like to offer a message of hope.
Yeah, my time with my dogs is what brings me joy. And I struggle with self-care myself. Obviously, anybody working the number of hours I would, it's not something that is second nature. And I have a hard time thinking about it as self-care because like many people in my generation, we feel guilty when we take time for ourselves. So I instead focus on making things fun. And so for me, when I have a day off, if I pick a friend or a family member and say, let's just spend the whole day having fun, for me, that's the best self-care I can give myself.
Mhm.
And I mentioned you mentioned big T, little T trauma, and we haven't talked about that. I don't have how much time do we have left? Always?
Yeah, you have a couple minutes. Go ahead.
Okay. So a lot of times when someone is overreacting, it's a response to trauma they had in the past, and it's not been dealt with to the point where it's been fully incorporated, and the negative emotions and the negative thoughts that cause negative behaviors have not been addressed. One of the things that I do in my mentorship and my one-on-one work is I help people release the negative thoughts and behaviors around that trauma so that they are less likely to get triggered in what is an intense, high stress environment filled with triggers. So when you do that and you take that person who's the one that's overreacting, you can bring their anxiety level down, but they also grow as a person in the process of that. So I've taken people who were labeled as dysfunctional physicians, and they are now in line to become head of department or have already become head of department, are being put in charge of multiple committees to move their organization forward because they figured out how to get out of their own way.
Yeah, well, thank you. And I recently read the book, The Body Keeps the Score, about trauma, so I can fully relate to everything that you're saying. And Audrey, if you would like to respond to anything Nan said, and also if you'd like to share what helps you overcome challenges and something that brings you joy.
Yeah, absolutely. So I think, we all have, but I have had my fair share of small t or little t, big T trauma. And I've been so fortunate and so grateful that I've been able to access the resources and the practitioners to really do the work. And so I can speak firsthand to one, you have to get down to the root. Just like in medicine, it's everything lies at the root. And our reactions are just that. They are reactions to what our brain thinks is keeping us safe based on what our trauma has lied to us and led us to believe. And so it's just learning to overcome that and knowing that one, you are not your trauma. Two, your trauma does not define you. You can choose to heal, you can choose to reemerge into a more aligned version of yourself at any point in your life. And I think it's so remarkable to be able to do that and to choose to do that. And I know for me now, it's through my daily practices where I'm again very fortunate that I'm able to carve out a chunk of my day to write down my gratitudes, to journal, to meditate, to do breath work, to move my body, and to also engage with my dog. But I have my set morning routines and nighttime routines that just prepare me for my day and then help me wind down for my day. And it just has made me so much more aware moving through my day-to-day of how am I responding? How am I showing up? Am I in alignment with who I want to be and what I want to achieve? Or am I sinking back into old limiting beliefs and old limiting patterns? And when you gain that awareness, then you gain complete power and complete control over your actions and over your responses. And you just become so much more aware and powerful and aligned. And I think that is a very strong place to be in to move throughout the world. And so I just know for me, we are the creators of our reality. We are in charge. We are not co-piloting. If we are letting other people dictate our lives for us, then we need to step back and establish those boundaries. Because at the end of the day, we know what's best for us and we know who's best for us. And so just being able to equip yourself and raise yourself to that next level of being able to take conscious awareness and alignment as you move out through the world and through your day. And it really does just change everything. And it makes life easier. Life is never going to be fully easy unless you run away to the top of Nepal and don't speak to anyone again, which sounds great. But we are in this world and it's very chaotic and it's very stressful. So how do you break that cortisol addiction? And how do you help yourself be the best version of yourself you can be? Not for anyone else, but for you. And when you direct your intentions towards yourself, that's how you can positively impact everyone else.
Yeah, absolutely. And these things aren't taught in med school. I'm learning now doctors don't really learn about nutrition in med school. They don't really learn about exercise in med school. They don't learn about these tools. So it's okay if this is new to you, right? And you can learn and it can make a huge difference. And I love the way that you each support doctors and your colleagues in the work that you're doing. And I didn't want to forget to show off my brand new Stand Up for Doctors. I have a logo now, and Dr. Martha Kenny, her husband Joshua, has a printing business, and he's helping me. So this is just a sample. So just one of the ways that I'm standing up for doctors. And so as we're winding down, Nan, how can our listeners get in touch with you?
Um, wow. Best way is to reach out to me on LinkedIn and send me a direct message. You can also go to my website, Beat Down Burnout, and send a message there. It's beatdownburnout.com, no spaces, very easy to find.
Okay, fantastic. And Audrey, how can our listeners reach out to you?
Like Nan said, LinkedIn is probably the best. Just sending me a direct message, or then also on the DFA website, doctorsforamerica.org. Under our staff page, my bio has my work email there. But LinkedIn is, I think, the best for all of us at this day and age.
And I believe that's how we all met each other. So, or how I met each of you. Yeah. Okay. Well, thank you again for being my guest today. I really enjoyed having you, Nan and Audrey.
Thank you so much,
My
Kim.
pleasure.
Okay, great. So in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.